Yes, good afternoon, everyone. Before I begin, I just want to acknowledge my collaborators, both at Mahidol University, UCSF, the Public Health Prevention Office, the NGO Rainbow Sky, and also University of Pittsburgh. So I'm the principal investigator of the study I'll be describing. It's actually a three-phase study, which began with the qualitative and formative research to understand the HIV risk context. And then the second phase, which I'll be describing today, the development and implementation of the intervention itself. And then there's a third phase, which is in parallel, and where finishing our data collection is the evaluation of this project I'll be describing today. So just some quick epi background. As many of you know, HIV infection in Thailand is very much in a crisis. In Bangkok, with prevalence being 30%. And if you divide that by groups, you'll see that the younger the MSMs are, the higher the incidence. And right now, the highest being approaching 10%. And this is among 15 to 18. And then in Ubon Ratchathani province, which you can see here, you can see on the right-hand side of the slide, it's a provincial Thailand. It's in the northeastern or Isan region, near Laos, different dialect, different culture, and seldom being studied or seldom being included in studies. And so I decided to go there and choose this region to work in. And here, HIV prevalence was taken a couple of years ago, and it was at 10%. So, good news and bad news, right? 10% is pretty high, but 10% is still lower than 30. How do we prevent this not being a Bangkok? And then with it, HIV testing countrywide is 20% or less. So we wanted to go with HIV testing and really improve that. I did ethnographic narrative interviews with lots of men in the phase 1 of the study, which I won't go into detail because this has been presented and the paper it's almost ready to be published. But pretty much it describes very complex everything from violence to the meaning of not using condoms to men not seeing themselves being happy, being with someone, being in love, not being alive in 5 or 10 years, and not seeing a normal life in Thailand as a gay man or as an MSM or as a man that have sex with other men. And so, this sort of, that's basically the main finding from the first phase. So for the second phase, we had a discussion among our team locally in Thailand, and then also with other institutions, other researchers in the US. And then we had a community meeting where we disseminated information locally, and then we asked the community, what can we do about this? And then finally, we created a core group of young MSM leaders. So here are some photos of team meetings and the actual community meeting, which was really, really helpful. And what emerged from this discussion was something that's very similar to an empowerment-based type of an intervention. First, for men to kind of love themselves, right, and then to love and to care for other men. And so this then emerged the empowerment project. We looked into this. This is part of the CDC effective behavior interventions. It's guided by these 6 guiding principles, which pretty much deals with empowering the individual, the community, using positive messages, using peer networks. So we adapted this for Northeastern Thailand in Ubon. Here's just some logos of other empowerment projects being conducted. The first 2, the one on the top, the ones being conducted in the USA, including among Black MSM in Texas. And then the one at the bottom is being conducted by Tim Lane at UCSF. It's called Botato, and that's being done in South Africa. So as far as we know, our project would be the first one in Asia. So they have a logo, we also have a logo. I'm also wearing the t-shirt. Let me just explain what it is. HUGM. The word hug is the local dialect that means love, and M is what a lot of guys call themselves as MSM. So HUGM, and then there's a slogan at the bottom here in the purple. Omgod Ti Pot Pai. This means safety and warmth with a hug. So HUGM, they're very clever, which translates to the English hug M, loving other M. MSM. So how is this different or similar to other empowerment projects? So 6 components. The first 3 very similar. There's a core group, building the community, there's publicity campaigns, and there's also small groups, and I'll go into each of these in detail. But then we also added 3 more components which emerged from the qualitative study. These included the social media campaign, the empowerment camp, so like a 3-day, 2-night camp for leaders, and finally a mobile HIV clinic. So advisors, so this is our core group of MSM advisors. On the left, you'll see how it started to be, that was our first meeting, it was very institutional, and it happened at the government office, and that just didn't work. And then on the right, you see our subsequent meetings are done at the Rainbow Sky House in Ubon, and very informal. So here are our publicity events. And the purpose of this 3-month intervention, I forgot to say, which ran from January to March 2014, was to not only attract large numbers of MSMs, young MSM in Ubon Ratchathani province, but also to reduce social and community-wide stigma that surrounds being MSM in provincial Thailand. So the kickoff event on the left-hand side is the HUGM supermodel event, where the winner actually became our spokesperson for the campaign. And on the right-hand side is the second kickoff event, the Valentine's Day event, where we had 4 gay-identified celebrities and their couples, so 2 couples right there who are kneeling down in the upper folder on the right. And of course, you can see our supermodel in the middle there. The bi-weekly small groups, so here's when we talk about really compelling issues that people wanted to really sit down and talk it out, right? These included coming out to families. How can safer sex be fun? Talking about risk behavior, what is risky, what is not, just sort of unpacking some of the myths. And then finally talking to friends about getting tested. The movies night was really interesting. These are Thai movies, they're gay themed, but then at the end, it ended up being talking about relationships, how to have one, talking about how to be an MSM and to be in Thai society. The social media campaign, Facebook, Instagram, and also YouTube, and it got lots of people involved. In our Facebook fan page, for example, we had different games that was online, and so guys had to come in and answer questions about safer sex or other things dealing with empowerment, and then they would get like a teddy bear, and you wouldn't imagine how many people actually went for that, and lots of people wanted teddy bears and t-shirts. And then finally, almost finally, the Life Skills Empowerment Camp. So this was a 3-day, 2-night event where peer leaders that's already doing stuff in Ubon Ratchathani province, they got together and then were taught about life skills and about empowerment theory and really, how to use empowerment with other people. And then finally, we did a mobile clinic. So this happened at the Ubon house, the Rainbow Sky house. And so we had these aunties, right? These are cool nurses who are MSM friendly. MSM really like them. And unfortunately, they work in a hospital that goes from 9 to 5. And guys want to get tested at 9 at night. So how does that happen? And so we had a mobile clinic in a safe space, safe place for guys to come in at the Rainbow Sky House. We did this every 2 weeks, and we had a good showing. So all in all, we had people coming in. The parentheses are the number of people who attended the different events. So 800 for the first one, the kickoff. The Valentine's Day, 1,300. The small groups were meant to be small, so 5 to 6. And then the empowerment cap, we maxed it at 40. And then mobile clinic. So we had lots of people who went to the mobile clinic, but then in the end, some of them were afraid to get tested. But 32 did in the 3 months. So we're still collecting the very last bit of data, so I don't want to really go to to that yet, but I'll describe a little bit what that is. But before that, just some numbers with the social media, which is totally different, right? 20,000 people visited our webpage. Instagram, 5,000, and then YouTube, 15,000. This is in 3 months. So how did I evaluate this? What we did was, in December, before the campaign started, I had a set of researchers who were totally different than the interventionists and not part of the intervention team. They went, just the two of them, and recruited 140 young MSM in Ubon Ratchathani province, and that was our community cohort. So this was in secret, and I mean, of course, informed consent and everything else, but it was in secret for the interventionists. So the interventionists, or even our NGO partners, didn't know who these 140 people were. So everything was as usual, right, from January to March. So we did a baseline assessment with them at the end of December. We did it again at the end of the project in April, and then now we're doing our final collection. So 3 time points, 3 months apart, baseline 3 months, and then 6 months. We wanted to know the penetration of the different components of the intervention, as well as, you know, did this really increase HIV testing? Of course, this is not powered to test the efficacy, and we don't have a control, but hopefully that could be something else that we can do in the future, is to have community controls. But at least it gave us some glimpse. So just like a quick peek, there seems to be an increase in HIV testing. So I'm just showing you the first and the third time points. The third time points is not really collected. It's not finished yet, and I'll be happy to answer any questions. I'd like to acknowledge the National Institute of Mental Health for funding this study, and also my colleagues at the different institutions. Thank you.